Honorable ladies and gentlemen, it's a great pleasure for me to welcome you to Accra and to the Republic of Ghana for the 28th Annual International Conference of the Association of Medical Councils of Africa. Ghana is honored to host this important event under the auspices of the Ministry of Health and through the Ghana Medical and Dental Council. And so on behalf of the government and people of Ghana, I extend a warm welcome to all delegates who have traveled from across Africa and beyond to be here with us this morning. And I hope that during your stay, you'll experience not only our proverbial Ghanaian hospitality, but also our enduring commitment to Pan-African cooperation, public service, and the health and dignity of all our people. The theme of this conference, Responsive Regulation for Safer Communities Towards Universal Health Coverage, is often discussed in terms of hospitals, health, insurance, medicines, and the number of professionals that we train. These are important, they are essential. But coverage without safety is incomplete. Access without quality can cause harm, and health systems without public trust cannot endure. Every professional license issued by a regulator is in effect a promise to the public that the person entrusted with a patient's life has been properly trained, has been fairly assessed, duly registered, and will be held to clear professional and ethical standards. Regulation, therefore, is not a bureaucratic obstacle. It is public protection. It is patient safety. It is the foundation of confidence in the healthcare. Public trust is the currency of every good health system, and regulators are among its principal custodians. Africa's health landscape is changing rapidly, as our keynote speaker noted. Our populations are growing and our disease burdens are shifting. We continue to confront infectious disease, as we've always done, while non-communicable diseases are increasing. Our health workforce is more mobile today than it was in the past. Our citizens are better informed and more knowledgeable, and digital health, telemedicine, and artificial intelligence are transforming how care is delivered. These developments create enormous opportunities, but they also create new risks for healthcare delivery. Technologies are emerging faster than many regulatory systems can respond to. Misinformation travels at the speed of light. Unqualified practitioners exploit gaps in enforcement. In emergencies and fragile settings, established systems of supervision and accountability may be disrupted. In such environments, regulation cannot remain static. It must be responsive. It must be firm. It must be fair. It must be protective and enabling. And it must be grounded in our African reality. But it must be informed by global knowledge. Responsive regulation is not simply about regulating more. It is about regulating better. It is about knowing when to guide, when to support, when to correct, and when to sanction. For Africa, the stakes are high. We cannot realize the aspirations of Agenda 2063 if our people lack access to safe, ethical, and quality healthcare. We cannot build productive economies if preventable illnesses continue to diminish the lives and livelihoods of our people. And we cannot retain confidence in our institutions if standards are weak or enforcement appears selective. Health is both a social good and a development imperative. The health of our people is the wealth of our continent. Let me therefore commend AMCOA for providing this platform for peer learning, regulatory cooperation, and continental dialogue. I also commend the Ghana Medical and Dental Council and the Ministry of Health for hosting this conference and for their continuing contribution to professional regulation, ethical practice, medical education, and patient safety. The first major challenge before us is how to protect patients during conflict, during displacement, disasters, and other humanitarian crises. In such settings, health workers may face danger themselves. Medical records may be lost, medicines may be scarce and unavailable, and vulnerable populations may depend on temporary facilities, field hospitals, and on foreign volunteers and mobile clinics. Regulators must therefore be able to verify qualifications, authorize emergency personnel swiftly, oversee humanitarian missions while maintaining accountability, without allowing urgency to become an excuse for abandoning standards. Indeed, when communities are most vulnerable, they deserve the highest level of a regulator's protection. The second challenge is the mobility and migration of Africa's health workforce. Doctors, dentists, and other professionals increasingly cross borders in search of training, employment, safety, and opportunity. This can spread knowledge and strengthen services, but its scale now demands much closer cooperation among regulators in different jurisdictions. Africa must not compete against itself for a limited pool of health professionals. We must cooperate to train more people, to retain more critical skills, verify credentials, recognize qualifications where appropriate, promote ethical recruitment, and distribute our workforce more fairly across the continent. A border may separate two nations, but it should never separate Africans from safe healthcare. Professionals who serve outside their countries of birth must also be treated with dignity and fairness, never with discrimination or hostility. Our health future depends on solidarity, shared standards, and mutual respect. The third point, we must govern the digital transformation of healthcare wisely. Telemedicine, electronic records, digital prescriptions, remote monitoring, and mobile applications can expand access, lower costs, and connect underserved communities to specialists. And Ghana has faced an example of this. We had invested in a digitalized medical record system, and the provider kept asking for more and more and more money. Of course, because he had the servers and he hosted the software, and it virtually became an issue of blackmail. And one day we woke up and the system was switched off. We had discarded all the old paper medical records, and so we had to go into the archives to pull out some of the existing records and also begin a quick fast track, substitute for the system that has been switched off. So these are some of the occupational hazards and dangers of digitalization of our systems. Yes, difficult questions arise. Which jurisdiction applies when a practitioner in one country advises a patient in another? And it happens. You call your doctor in a different country, in a different regulatory environment, and he gives you the service. So which jurisdictions regulation apply? These are all questions that we must ask. What standards govern an online consultation? Who is accountable when an algorithm contributes to a harmful decision? Now we have AI taking some decisions on behalf of human beings. And so if the AI makes the mistake, who will the medical and dental council summon to sanction? How do we protect our health data from misuse? And how do we prevent digital platforms from becoming channels for unlawful advertising, fraud, or unsafe practices? The answer is not to resist technology. The answer is to shape it in the public interest. Artificial intelligence must support, not displace, professional judgment and human responsibility. Africa must participate in setting standards, generating evidence, and designing technologies that reflect our populations and realities. Responsive regulation must bridge innovation and public confidence. And there's another example I found interesting. An AI had been developed to better diagnose breast cancer and lumps in women's breasts. Now, those who fed the algorithm fed it from several cases of identifying breast cancer in Caucasian breasts. They didn't realize that African breasts are a bit denser than Caucasian breasts. And so, I'm sorry. If I've addressed a very sensitive issue. Yes, but women's breasts are said to have more tissue, but they have a lot more mass than Caucasian breasts. And so just going and taking AI and the software and coming and saying, we have a new AI for identifying breast cancers, you probably will be misdiagnosing. So these are all the safety issues that come up. Now my fourth point, we must confront forged qualifications, fake licenses, professional impersonation, fraudulence, continuing development certificates, unlawful practices, and misleading health claims. When a fraudulent practitioner enters a consulting room, every patient who enters that room becomes vulnerable because fraud recognizes no borders. And so our response to fraud must be continental. No country should become a refuge for a practitioner who has been sanctioned elsewhere. And no community should be exposed to danger because regulators could not share verified information with each other on time. Secure, lawful, and timely data exchange among African regulatory authorities is therefore no longer optional. It is an essential instrument of patient protection. And the fifth one, our regulatory systems must become integral to Africa's health security architecture. COVID-19 reminded us that the next emergency is not a question of if, but when. Emerging infections, antimicrobial resistance, and climate-related health threats all require systems that can act quickly without sacrificing quality. Climate change is already affecting our health through floods, droughts, fires, and insecurity, displacement, and changing disease patterns. Antimicrobial resistance threatens to reverse decades of medical progress. Many future threats will arise at the intersection of human, animal, and environmental health. And so for that reason, regulators must embrace the One Health approach and work with public health authorities, veterinary regulators, environmental agencies, laboratories, and research institutions, because preparedness cannot begin only after a crisis has arrived. Now I'll tell you a little about Ghana. Ghana's health agenda is anchored on equity, equality, and sustainability. We're strengthening the National Health Insurance Scheme, and we currently have a national coverage of 76%. We're hoping to push up. We're hoping to push up to 90. But as Dr. Anefi tells us, even 90 is an ordinary pass. We wouldn't have failed, but it would just be a pass because it means that 10% will still be uncovered. And that is why we have introduced two new schemes to go alongside the National Health Insurance. And the one of which I'm most proud is the free primary health care program. And I want to thank the World Health Organization and all our partners, the government of Kenya, whom we copied copiously from. You can claim copyright, Captain, after this, after this function. And so we are modeled a bit on the Kenyan free primary health care coverage. And we've started with about 160 districts. Ghana has 260. So we still have 100 districts to onboard. But that is where the preventive side of our healthcare is being implemented. And this covers mostly people in the rural areas who have no access to the facilities, have not been covered by the National Health Insurance. They can go to any of the CHIPS compounds, the mobile health kiosk, and receive treatment free of charge without showing any identification. And so we believe that that will help us one more step towards universal health coverage. We're pursuing free primary health care so that cost does not prevent people from receiving essential care at the point of need. Through the Ghana Medical Trust Fund too, we are seeking to protect persons living with chronic and high-cost conditions from financial hardship. We're also advancing the conversation on African health sovereignty. Health sovereignty does not mean isolation. It is the capacity to meet our people's needs confidently, competently, and through mutually respectful partnerships. Africa must invest in its workforce. We must mobilize sustainable financing. We must expand local production of medicines, vaccines, and health technologies, and build reliable data systems. In Ghana, 70% of the medicines that we consume in our health system are imported. We've come up with a 5-year plan to make sure that we reverse that, and that at least 70% of the medicines we consume must be produced locally in Ghana. We must also invest in governance standards, ethics, and trust. This is where strong, independent, and adequately resourced regulators become indispensable. And so now let me inflict on you the 7 points of reflection for this conference. And I assure you they will be briefer than Professor Anefi's finally, last finally, first finally. I have no hidden finals here. And so first, over the next few days of your meeting, I urge you to focus on 7 priorities. The first is to strengthen regulatory harmonization through deeper cooperation, reliable verification, and appropriate recognition of qualifications without lowering standards. The second must be to invest in regulatory science so that decisions are informed by evidence and regulators have the skill to respond to new technologies, changing workforce patterns, and emerging risks. The third is to build secure data exchange systems that support timely information sharing while respecting privacy and proper data governance. The fourth is to protect the integrity of health professional education. The quality of tomorrow's healthcare depends on the quality of the training that we give today. Accreditation, assessments, internship, continuing professional development, and ethical formation must remain central to this objective. The fifth is to develop practical frameworks for humanitarian and fragile settings, enabling rapid emergency response while preserving standards and accountability in times of crisis. The sixth is to regulate digital health and artificial intelligence with urgency, wisdom, and a clear commitment to equity. And the final, and the seventh, is to place the patient and the public at the center of every regulatory decision we take. The true measure of a regulator is not how many licenses it issues, but how effectively it protects the people and the patients. Universal health coverage cannot exist without universal health confidence. Citizens must know that whether they enter a clinic, a hospital, theater, or even on a digital platform, the professional attending to them is competent, ethical, and accountable. So this conference must move beyond discussion. It should produce practical outcomes, stronger collaborations, implementable policy recommendations, capacity building plans, improved information sharing, and a renewed continental commitment to high standards. And so let this Accra conference mark a new phase in African health professional regulation. Let it be remembered as the gathering at which regulators embrace not only national mandates, but also a shared continental responsibility and affirm that patient safety has no borders. To you regulators, I say, your work may not always be visible, even though Professor Nefi says you should make sure you make yourselves more visible and let the public know what you're doing. But still, your work may not always be visible, but it is vital and critical. When regulation works, harm is prevented, confidence is preserved, and lives are protected. And so you are guardians of the public interest. And to us policymakers, the minister and myself, I say let us provide regulators with the legal authority, institutional independence, the resources and technological capacity required to perform their duties effectively. That is the duty of us policymakers. And we have to work with our international partners. And so to our international partners, I say support Africa not only to deliver health services, but also to govern those services well and strengthen the institutions that sustain them. Ghana believes deeply in African cooperation. Our common challenges require common solutions, whether in health security, workforce development, digital transformation, professional mobility, emergency response, or regulatory reform. No African country can succeed in this alone. We must learn from one another, we must support one another, and build systems that are African in ownership, global in quality, and uncompromising in their protection of the public. As you deliberate in Accra, I encourage you to be bold, practical, and forward-looking. Let your discussions be honest, let your recommendations be implementable, and your partnerships enduring. And so, on behalf of the government and people of Ghana, I once again welcome you warmly. May your deliberations be fruitful, your contributions to Africa's health future be significant. And with these remarks, and I'm done, I assure you, it is my honor and privilege to declare the 28th Annual International Conference of the Association of Medical Councils of Africa officially open. I thank you.